Hello, my name is Lydia Pittman, and this is my video blog on ethical violations. As far as the first question about what some of the most common reasons for a board to discipline a counselor are, I think a few of those that I've seen had to do with client consent, had to do with working with multiple clients, and basically just the relationship between the counselor and the client. Another theme that I saw in a lot of the court cases had to do with insurance fees and sexual misconduct. I think that was another one that, again, related to the actual client and therapist relationship and how that has to be within the correct boundaries and correct parameters. And if it's not, then these types of violations can end up occurring. One of the court cases that I found was basically MHC versus Stewart, and MHC stands for mental health care. So in this case, there was a patient named Mr. Cox who was a schizophrenic. Mr. Cox was assigned to a clinical case manager named Miss Perkins, and her job was to help him to basically develop independent living skills. So things like hygiene, things like going back to school and getting his life back on track, things like that, helping him with his behavior and process and how to process his emotions and all of those things. And that was her job. So one day, Mr. Cox overdosed on pills for his schizophrenia, and he was admitted to a hospital. Now, when he was admitted, he was exhibiting very erratic behavior, and the behavior was described as sad, hostile, irritable, and defensive. And so not only was it irritable, but it also was very, very violent. And so one of the nurses named Miss Perkins, who was assigned to Mr. Cox's case, didn't know that he had this tendency to behave this way. And so she ended up getting hit in the back of the head by him very, very badly. And he caused brain damage, and she needed surgery, and her eyesight was affected, and all of these things. And so she filed a case against MHC because they did not inform her fully of this client's erratic behavior. And the case was settled, and the jury voted in favor of Miss Perkins. So basically, the MHC ended up owing $901,415 in damages. And so that basically just kind of shows the importance of being candid about your client and being candid about their tendencies and what they are, what they can go through. The ACA Code of Ethics has a value that can actually help counselors against counselor impairment, and it's Section D1B, which says forming relationships. And basically it talks about the importance of counselors forming relationships with other counselors that can basically give them a good support system and help them answer questions and ask questions that could perpetuate their career in a healthy way. And so I guess one of my questions based off of all of this research was, if you are working with a suicidal client, how and who has the knowledge and who should be privy to all of their behavior? Because obviously their main counselor should be, but then also who at the hospital is privy to that information. I know the confidentiality is an issue. And so I guess just the inner workings of who and why and how they should know things was one of my questions. But overall, I loved researching this, and I hope you all have a great day.